Good day, everyone. We would like to start this workshop by introducing ourselves. I am Leigh-Ann, and I am excited to be part of the health campaign. The health campaign has retained multiple OBGYN doctors, nutritionists, and health coaches to help you along this journey. Seeing all in attendance indicates to us that you are willing and ready to start this new journey of life, to regain hope, your confidence, and to become a better, healthier version of yourself. Again, welcome to the health campaign. And before we get started, here's a question to ask yourself. Please be open in your responses. What do you hope to gain from this workshop as an individual and as a family? Our objective at the health campaign is to teach women and help them and their families learn of preventative measures of dealing with polycystic ovarian syndrome, also referred to as PCOS, defining what it is, and addressing dietary changes, workouts, and visiting doctors and health coaches. So, what is polycystic ovarian syndrome? PCOS is a genetic hormone, metabolic, and reproductive disorder that affects women usually between the ages of 13 to 40 and above. It affects their hormone levels. It is the leading cause of female infertility. Raise your hand if you have ever felt depressed, anxious, suffering with weight gain and trouble taking it off, insulin resistance. PCOS causes all of this and more. When you suffer from PCOS, your body has a difficult time releasing insulin to break down the sugars from your diet. As a result, much more are stored within your body and in common areas such as your arms, your lower stomach, and your inner thighs. This increases the risk of developing type 2 diabetes. So here are some statistics to be mindful of. Every 1 in 10 women are affected with PCOS. 50% of women with PCOS go undiagnosed. There is a 50% chance of developing type 2 diabetes, cancer, and other illnesses before the age of 40 as a result of PCOS. An average of 5 million women within the US are affected by PCOS within their childbearing ages. So, here are questions. Have you gone to visit your OBGYN? Do you trust doctors enough to make a diagnosis? Or are you simply overlooking the symptoms because you're scared of what may happen? So, question, and please be open. What stops you from visiting your doctors? As we talk about these symptoms, I want you to let me know if any of these symptoms seem familiar to you. Whether it's one of them or multiple of them, let us know. Some common symptoms of indicating PCOS within your body are irregular periods, excessive facial and body hair, acne, infertility, weight gain, insulin resistance, hair loss or thinning, mood swings. These are all common symptoms, and there is so much more that you can use as indications that you may possibly have PCOS, and it shows the importance of needing to visit your doctors. PCOS can be so common and it can be overlooked that you don't know what's going on within your body, and it's why it is so important that you visit doctors and that you learn of it. So, within the health campaign, we have come up with 3 very simple and effective methods of preventing and coping with PCOS. So the first step, visit your OBGYN. Why is this so important? We just explained it. It is so important because they will be able to properly diagnose you, perform tests such as an ultrasound and blood work to view your ovaries in order to know if there are any cyst formation on your ovaries, and a blood test to be able to indicate your different level of hormones, and if you have insulin resistance, if you have diabetes, your blood work will be able to indicate this to your doctors. And as such, they'll be able to give you the proper medication. Perhaps birth controls may regulate your periods or tablets to regulate insulin within your body, but you will not know which is more effective for your body unless you visit your doctors. Second step, changing your diet. Visit a nutritionist or a dietitian. Changing your diet, sometimes we can go drastically into this change. This might be one of the most difficult steps, I'm not sure, but who prefers fast food over a salad? Who enjoys grilled or steamed meat over fried chicken? Safe to say, not many. But having a healthy diet does not necessarily mean drastically cutting off everything from your diet and eating only salads. Our dietitians and nutritionists will talk more about the importance of having a calorie intake specific to your body and how much more important it is to have portion control rather than drastic cutoffs. So the third step, working out. The next to changing your diet, working out is probably one of the hardest things to do. Who works an 8 to 5 job? Show of a hand. Who has a job and school online? Or 2 jobs, kids, or a family to care for? Finding time within a busy schedule can make it difficult, but the importance of being active and exercising surpasses anything else. You must be able to take care of yourself before taking care of others. Finding 30 minutes is better than needing to visit a doctor again. The health coaches will be there to show exercises that can be done at home without additional weights and is quick and effective. The more you are active and working out, the better your body responds to releasing insulin and burning the sugars and fats rather than storing it within your body, further decreasing the chances of developing diseases or PCOS. Thank you for being here. The time is now. It is time to change and become a better version of yourself for your family. Thank you for listening and for being here. Please meet our doctors and health coaches at their station. Enjoy refreshments provided. Take a file with you and feel free to contact us for any further information.